Hello friends, welcome to Forensic Medicine by Dr. Paris, and now we are going to talk about chapter number 7, that is asphyxial death. So first we'll see some basic definitions and then we'll talk in detail about the findings also, about the nature also, mode of injury also, whether it is anti-mortem, whether it is post-mortem, everything we are going to discuss in detail, my dear friends, in this chapter. First thing is asphyxia. Asphyxia means what's a pulselessness. Once the pulse is absent, the circulatory failure is there. After that, what will happen? After the circulatory failure is there, the tissue will not get the oxygen. Moment the tissue is not getting the oxygen, the tissue will go under the hypoxia. The tissue will go under the hypoxia. And then after that, necrosis will happen. So asphyxia is nothing but your pulselessness. The pulselessness is causal asphyxia. Hypoxia is lack of oxygen. What is hypoxia, my dear friend? Lack of oxygen is called as hypoxia. So two terms are clear in our head right now, sir. One is asphyxia, that is pulselessness. Pulse is absent right now. Now, pulse is absent, that means circulatory collapse is there. Moment the circulatory collapse is there, the tissue will not get the oxygen. Tissue will not get the oxygen, there will be lack of oxygen, and lack of oxygen is called as hypoxia. Now, sir, what is there in the classical triad of asphyxial death? So this is not a significant triad that it is seen only here. This is also seen in the other places, but we also see in the asphyxial death, that is CPC. How to remember, sir? CPC. CPC triad. What is C? C for cyanosis. Cyanosis. In cyanosis, you will see the skin will turn blue. If there is a asphyxia, if airways are blocked, my dear friends, because of that pulselessness will happen eventually. Because of the blockage of the airways, then the pulses will go down, because circulatory failure will also happen. Cyanosis, there will be a blue skin, my dear friends. And then coming to PP for petechial hemorrhage. And this petechial hemorrhage is happening because of a rupture of capillaries and venules. Rupture of capillaries and venules are the regions, and petechial hemorrhage, if it is happening like on eyes, will form the Tardieu spots, my dear friends. If it is happening on the eye, it will form the Tardieu spots. And not only in the eyes, this petechial hemorrhage can also happen in the heart, can also happen in the lungs, etc. It can happen anywhere, most commonly from the external finding. If we see this petechial hemorrhage in the eyes, you will see there will be a Tardieu spot. Tardieu spots are nothing but pinpoint hemorrhage in the conjunctiva, my dear friends. And third thing is congestion. Congestion is happening because the blood is not going anywhere. Blood is accumulated at one place. Moment the blood is accumulated at one place, there will be redness. So three things we need to remember right here, sir. One is cyanosis, then petechial hemorrhage, then congestion is there. Plus one more feature you can see right here, because of asphyxial death, there is lot of suffocation. The body tries a lot to survive actually. There is a lot of struggle. The internal organs are also suffering a lot. Because of that, you will see one more thing, one more feature is there, sir. Right ventricular enlargement. Right ventricular enlargement will be there. Enlargement will be there. Moment the blood is going from right atria to the right ventricle. From right ventricle, blood need to go in the lungs. But due to the failure of respiration, the blood is not accepted in the lungs. So all of the blood is getting accumulated in the right ventricular only. That is why the right ventricle become big, and there is a right ventricular enlargement. So these are the classical things you will see in the asphyxial death. Not only in asphyxial death, other type of suffocatory death also you can see these features, my dear friends. Now, first feature we need to discuss right here. What is the first feature we are going to discuss? Sir, Tardieu spots. Tardieu spots is happening because of the venous congestion. Venous congestion, venous, venous, or there will be capillary congestion also can happen, can be a reason. So there is a pinpoint hemorrhage in the conjunctiva. In the conjunctiva, the white part, the conjunctiva is there in the layer in the eye. In that, hemorrhage is happening, and not seen in suffocation and drowning. In suffocation and drowning, you are not going to see the Tardieu spots. Suffocation and drowning. Drowning commonly you will see, do not see the Tardieu spot, my dear friends. Now these you will see that pinpoint hemorrhage. Now one more thing you need to compare right here only, sir, trachea. Trachea you have seen eye like this. Trachea is normally happening after the death. There is a triangular shape hemorrhage like this, sir. If I draw here, there is a triangular shape hemorrhage. The collection of debris, epithelium cells, that debris of epithelium cell is there, sir. And the part involved here would be, sclera. But Tardieu spot, if we compare right here, sir, with the Tardieu spot, conjunctiva is involved, my dear friends. And trachea noir is seen in normal death also. And Tardieu spot is specifically dealt with what, sir? It is seen in the congestion. Whenever there is a suffocation, whenever there is a asphyxial death, my dear friends, you are going to see the Tardieu spot. Whenever your compression of neck is there, hanging case is there, sir, and all those things, you will see the Tardieu spot, and that too seen on the conjunctiva. Now, sir, done. Now, sir, there is a weight of constriction you need to remember right here. What are the different weight of constriction? See, what weight is required to constrict what organ will be very important in the topic called as partial hanging and the complete hanging. Sir, in the complete hanging, what will happen? The whole of the body weight will be acting as a constricting force, and that will be the cause of death. But in the partial hanging, where your body is touching the ground, but the death will happen because of the weight of the head. How much is weight of head? 10 to 15 kg depending on the person. So death will be happening because of the weight of the head, and head will constrict which organs? So jugular vein, carotid artery can be easily compressed with the help of head weight, and that will be the cause of death in case of the partial hanging. That is why remembering all these weights are important for your chapter. Now, the mnemonic right here to remember would be like this, JCTV. The mnemonic will be JCTV. Sir, J for jugular vein. How much weight is required? Sir, 2 kg. Just 2 kg weight is enough to compress the jugular vein. Then, sir, C for carotid artery. C for what, sir? Your carotid artery. Carotid artery, sir, it will be your 5 kg. Carotid artery, 5 kg. Then we talk about, say, trachea 15, vertebral artery 30. So 2, 5, 15, 30. 2, 5, 15. You can see right here, sir. 2, 5, 15, 30. Your JCTV, jugular vein, carotid artery, trachea and vertebral artery, my dear friends. Coming to right here, sir. Post-mortem in the asphyxial death. So post-mortem in the asphyxial death, you will see modified Y incision. We give, sir, what? Modified Y incision. And from where to give the modified Y incision? From this area, sir. Mastoid area. It starts from mastoid area. Then it will come to the suprasternal notch. Then it will travel to the pubic symphysis. It will go like this, okay? If I can show you right here, sir, if I draw the man here. So you can see right here, sir, it is starting right from here, going right here. Then it is going down like this. So what is happening? We are sparing neck here for the last. As it is written here, bloodless dissection is needed. So what we do right here, sir, if I just erase it and write something for you, that bloodless dissection, whenever there is a asphyxial death, my dear friends, the first cavity we open is a cranial cavity. After cranial cavity, what will open, sir? We'll open the lungs. After lungs, what will open, sir? Abdomen. After abdomen, what will open, sir? Thorax. So why thorax in the last? Thorax in the last because we need blood less dissection. Other method can also be there in which we puncture the jugular vein. Jugular vein, because of puncture of jugular vein, blood will be drained and you will get the bloodless dissection. Bloodless dissection. You will get the bloodless dissection, sir. So these are the post-mortem techniques in the asphyxial death we follow, sir. And first cavity need to be opened would be the cranial cavity, followed by your lungs, cranial cavity, followed by your lungs, followed by your abdomen, followed by your thorax. No, sorry. Throat. It is not thorax, it is throat. Throat in the last, not thorax, it is throat, my dear friends. Very sorry. Now coming to the hanging. So next topic is hanging. So type of hanging, if we talk about, sir, it can be complete hanging or incomplete hanging. So what do you mean by complete hanging and what do you mean by incomplete hanging? Sir, if I draw right here, sir, complete hanging, you will see, sir. Complete hanging, you will see. I'll draw like this. You can see right here, sir. Now you can see right here the complete show. This is ground. This is ground. And this is ceiling. Now this complete hanging you can very well see here. There is no contact of ground with the body. That means entire. This is complete hanging. This is complete hanging. This is what, sir? Your complete hanging will be there. Next type of hanging you can see right here, sir. This person. This person. Now some object is there. Now, sir, object is there. That means the body is touching the object. This is partial. The body is touching the object. If any object or ground, this can be object, this can be ground also. If a body is touching the object or the ground, that will be your partial hanging. Partial hanging. Partial hanging. So, what is happening? What is happening in the complete hanging, my dear friends? You will see the complete hanging can be suicidal, can be homicidal. These can be what, sir? Suicidal also. Person can die by himself, and homicidal also. But partial hanging is mostly homicidal. Partial hanging is what, sir? Mostly homicidal. Now, complete hanging, you know the cause of death is what? In the complete hanging, your cause of death is entire body weight, which is acting as a constricting force. But in the partial hanging, what is happening? The person is in comatose state. A person is in unconscious state. Unconscious may be toxicated patient. Person was first toxicated, then he or she was hanged till death. Well, anything can happen. Now, sir, you notice right here. Now, the body is touching the ground. Then how the person died? As I mentioned, the person was unconscious. As the person was unconscious, now the constricting force will be weight of head. Now, constricting force will be weight of head. So, you will see here the mnemonic we have read. What is the constricting force required? The mnemonic was like this, sir. JCTV. Sir, jugular vein, carotid artery, thorax, and vertebra. So, need how much weight to constrict this, sir? Sir, 2, 5, 15, 30. 2 kg, 5 kg, 15 kg, 30 kg. As you can see here, sir, weight of head is how much? Approximately 10 to 15 kg. So here in the partial hanging, if I can show you, your cause of death will be what, sir? Asphyxia, plus there will be a cerebral venous congestion. There will be a congestion of jugular vein, carotid artery. So cause of death in case of partial hanging will become your asphyxia, plus there will be a congestion, cerebral venous congestion. There will be jugular vein plus carotid artery which will be compressed, because of which blood will not go in the head and the person will die. So this is a basic difference between the partial and the complete hanging, my dear friends. Now you will see another thing is incomplete hanging. Some parts are touching the ground, and because of that the constricting force will be the head, and the two things will be compressed. One is carotid artery, another is jugular vein, my dear friends. This part is very much clear to all of you. Now other type, on the basis of knot. So on the basis of knot we have divided it into two parts. What two parts we have divided into? One is typical hanging, another is atypical hanging. So my dear friends, if I can show you right here, sir, typical hanging. In the typical hanging, where your knot is placed, you can see right here, sir. In the typical hanging, your knot is placed at the occiput. The knot is placed at the occiput here at the back. The knot is placed at what, sir? Occiput. And if I talk about the atypical hanging, the knot can be placed anywhere. The knot can be placed anywhere other than the occiput. If the knot is placed, that is called as what, sir? Atypical. Atypical. Now, on the basis of ligature material, another is on the basis of ligature material. You can write right here, sir. On the basis of ligature material. On the basis of ligature material. Sir, if ligature material is thin, you will see the deep mark will be there. The marking will be very, very deep. Deep mark will be there. If thin material is there, it can penetrate the skin very, very easily. That is why deep mark will be there. What will be there, sir? Deep mark will be there. So there will be a deep ligature mark. Deep ligature mark. So with this, the medico-legal importance will be, you will come to know about the type of material which is used. If the ligature material is thick, there will be a superficial ligature. Superficial ligature mark. There will be superficial ligature mark, and there will be, yes, there will be abrasion, pattern and pressure. Pattern and pressure, that will help us to tell the material used. A material can be anything, can be dupatta, can be rope, can be wire, can be anything. On the basis of abrasion, we can figure it out whether this is thin or thick, or what type of material it can be. It was used for the death, my dear friends. So on the basis of ligature, we have cleared. Now another, on the basis of knot. Please write that, sir. On the basis of nature of knot. On the base of nature of knot, my dear friends, there are two type of knots we are having. You can write here, sir. Two type of knots we are having. One is fixed knot. Another is slip knot. Fixed knot and slip knot. I'll just show you, then we'll talk about this. Sir, if I am tying a knot like this, if a knot is fixed here, it is not slipping at all. It is fixed here and not slipping at all on applying the pressure. This knot is called as fixed knot. And moment knot is fixed, you will see incomplete oblique ligature mark. Incomplete oblique ligature mark in the fixed knot. Now what is slip knot? Moment I tied a knot like this, I'll show you right here. Moment the weight is entering, the knot is becoming tight. Moment weight is there, the knot is becoming tight. Moment the knot is becoming tight, now you will see the ligature mark is transverse. And ligature mark is what, sir? Transverse and complete. Transverse and complete. Ligature mark. In the slip knot, what will happen? The knot will slip and it will tightly attach onto the neck, and because of tight attachment of the neck, there will be a transverse and complete ligature mark. Transverse and complete ligature mark, my dear friends. So we'll see right here, sir. Complete ligature mark. The fixed knot, oblique. Yes, what are the properties of fixed knot we are having, sir? Oblique and incomplete ligature mark. Oblique and incomplete ligature mark. In the slip knot, there will be complete and transverse ligature mark. Complete and transverse ligature mark. So this is based on the ligature material, based on the nature of knot, then the place of the knot. One is typical, atypical, then there will be complete and the partial hanging. So beautifully we have discovered everything, my dear friends. Now we'll talk about the methods of hanging. We talk about the methods of hanging. In method of hanging, first is suicidal hanging. Sir, suicide is most commonly used as hanging because the fetal period is less. It's the most common method of hanging because the fetal period is less as compared to the drowning. In drowning, the person will suffocate more, and that will be a painful death. In the hanging, the person will not suffocate more. There will be a sudden cessation of the vascular activity right here, sir. Vessels, there will be asphyxia, later on hypoxia, person will die, person become unconscious. Moment there is a sudden fall of body. Moment there is a sudden fall of body, you will see the person will be going unconscious and the person will die within 3 to 5 minutes. And that is why the most common type of method would be the hanging, my dear friends. And fetal period is 3 to 5 minutes. And yes, the sign of struggle is present. Sign of struggle in the suicidal hanging means the person the sign of struggle is absent. What is sign of struggle means? Sign of struggle means if someone is, just imagine the situation. If someone is forcefully making you hang, like one mob is there are 15-20 people who are forcefully trying to hang you. If they forcefully try to hang you, what will happen? You will try to save yourself. While saving yourself, you can be scratching. So there will be a skin on your nails. You might be doing your hand like this to save yourself. Don't do. And while doing this, there might be a contusion, laceration, abrasion on your body. So abrasion, laceration, contusion can be seen on the body. Plus, if more force is applied, there can be a high chances there are the fractures also in the body. So in the suicidal hanging where you are killing yourself, now you imagine whom you will scratch. There is no one. You are alone there. Whom will produce the bruises, etc. on your body? No one. That is why the sign of struggle is absent in the suicidal hanging and it is present in the homicidal hanging. So next topic what we are going to discuss would be what's your homicidal hanging. So homicidal hanging, what will happen? Homicidal hanging, the sign of struggle struggle present. The sign of struggle is present. Homicidal hanging, the sign of struggle is present. Sign of struggle means what? I'll just write it here, sir. Sign of struggle means, sir, what? There will be abrasion, laceration. There can be abrasion, laceration. There will be bruising, or you can say contusion. There can be a fracture of multiple bones. So these are the signs of struggle when person try to save. Maybe tearing of clothes. Maybe tearing of cloth can be seen, sir. So these are the signs of struggle present in a homicidal hanging. Now coming to the third part is judicial hanging. So judicial hanging is practiced in India and the most common fracture would be your C2 vertebra, and this is also called as hangman's fracture, judicial hanging, which is practiced in India. Now, in this hanging part, if we talk about the ligature mark, it is above thyroid or below thyroid? Remember, it is mostly above. Mostly above the thyroid. You will see this ligature mark above the thyroid. Now, the fourth type of hanging is accidental hanging, and this is most commonly seen in the sexual pleasure. Accident hanging, first I'll just explain you the thing. Accident hanging in the sexual pleasure, erotomania, what we can call that as well. So what is happening? The person feels good when someone is strangulating the neck, choking the neck. That will compress the veins, which will cause hypoxia for a few minutes or a few seconds, and that will produce the orgasm. So these people are in regular practice of doing these things. Moment two people are having sex and the other person is demanding that please choke me. While choking, she get the pleasure or he will get the pleasure. So they people are loving, are love in suffering the pain, and those kind of people are called as masochist personalities. So what the things we can learn right here, sir? There is a partial, not complete neck compression is there, partial neck compression. It is sexual pleasure. So what is the mechanism of injury or death? You can say right here, sir. What is happening? There is a partial compression of neck. So there is partial compression of neck. Because of that partial compression, there is a carotid compression. Because of carotid compression, there will be cerebral ischemia. Because of cerebral ischemia, there will be hallucination, and these are erotic, or you can say sexual hallucination. And this sexual hallucination will get the orgasm, and after releasing pressure, person become normal. And sir, if after releasing the pressure, not person, pressure, the person is not getting normal, it will cause death. So this is how the death can happen in the sexual pleasure. Mostly person is like this material is there, he is using this material, he is partially choking himself. Then after some time, he is releasing the pressure or she is releasing the pressure, orgasm, releasing, orgasm, releasing, orgasm, releasing. But one time, he just forgot. And this thing can happen like this. Two partners are there, female is demanding, choke me. And the male is very heavy, he is choking the female. And while choking, they are having lot of pleasure. They forgot to remove the pleasure. Failure to remove the pressure will lead to the death of the person, death of the partner, my dear friends. So this is what we have learned in the sexual, which is accidental hanging. Mostly it is accidental only. Now, the cause of death in the hanging is what's an asphyxia. And the most common cause of delayed death in the hanging would be what's a hypoxic ischemic encephalopathy. What will happen, like HI is also most common cause of seizure. Seizure activities is happening most commonly because of the hypoxic ischemic encephalopathy, my dear friends. It will increase the electrical activity because the brain is suffocating. The moment the brain is suffocating because of low oxygen, brain will be overstimulated, hyperactive. So because of hyperactivity of the brain, there will be increase in electrical discharge and it will lead towards a seizure disorder. Now we'll check something called as what's a post-mortem finding in the hanging. So we'll talk about post-mortem finding in the hanging. First we'll talk about the external finding. External finding, there will be a seminal discharge. Seminal discharge will be seen, my dear friends. Plus there will be a liver motif seen on the hand, foot and penis. This is also called as glove and stocking distribution. So what this liver motifs will tell you right here? Liver motifs will tell you that body was in vertical position. Body was in vertical position. And what is this liver motifs? Liver motifs is what's here? Hypostasis. It is bluish discoloration of the body parts, and that to which parts are dependent part. And while body was in vertical position, if I draw right here, sir, for all of you, if a hanging case is there, body was in vertical position. So we'll see the organs which are under the high influence of gravity. What organs can be there, sir? One is your penis, feet, hand, and the lower part of the chin also. There will bluish discoloration. There will be a bluish discoloration because of what, sir? Deoxyhemoglobin. Deoxyhemoglobin. Because of the deoxyhemoglobin, you will see liver motifs in the hand, foot, and penis. Normally, if the body is in horizontal position like this with the ground, now the parts will be touching the body. The parts will be touching the body would be what, sir? Your pale. The parts which are touching the body will be pale. But these are the dependent part. They will be again bluish in color. So this is what liver motifs concept is right here, sir. Now we are coming to the face. On face of hanging person, there will be a term called as what, sir? Your law facies sympathetici. What is law facies sympathetici? You will see right here, sir. Opening of eyelid and dilatation of pupil. Opening of eyelid, if we draw like this, opening of the eyelid and dilation of the pupil. Other eye will be like this. Plus there will be a protrusion of the tongue. Plus there will be what's a protrusion of the tongue outside. And dribbling of saliva. There will be dribbling of saliva opposite to the site of protrusion of tongue. Dribbling of saliva is also coming. So opposite side of the knot. See, if the knot is here, here like this, if the knot is here, you will see this area is free area, no pressure here, but the opposite side here will be compressing all your glands. The opposite side will be compressing all your glands, my dear friends. That is why there is dribbling of saliva, protrusion of tongue, and the opening of the eyelid and the dilation of pupil, the opposite side of the knot. Its knot is here, then the rope will be going like this. This area untouched, this area fully compressed. Because of fully compression of the area, there will be a dribbling of saliva from the opposite side of the, this is what la facies sympathetici, or you can say la facies sympathetici. La facies sympathetici, you can call this. Now, sir, now what will happen, sir? and this eye will open. The opening of eyelid, the dilatation of pupil will be on the same side of the knot. Just redraw it beautifully again. My drawing will be there. This opening of eyelid and dilatation of pupil will be on the same side of knot, and protrusion of tongue and dribbling of saliva will be on the opposite side of the knot. If I draw right here, sir, if this is a knot, if this is a knot, you will see opening of the eyelid with dilated pupil, you will see on the same side, plus there will be a dribbling of saliva and protrusion of tongue on the opposite side. Now you can understand better. Opposite side. Now, sir, we'll talk about the next thing, that is called as neck. Neck, you will see oblique and above the thyroid. Above thyroid. If I am taking, where you will see the ligature mark, sir, ligature mark. Ligature mark. Where you will see the ligature mark, my dear friends, you will see right here, sir. If person is dying because of hanging, you will see there is a knot like this. Now there is a knot like this. You will see there will be oblique mark. Where it is coming? Above the thyroid. There is a oblique mark like this. Oblique mark, and incomplete oblique mark will be there. Incomplete oblique mark will be there. So you will see pressure abrasion on the neck is seen, which is above the thyroid level. Pressure abrasion is seen, and it is oblique incomplete. Oblique, we'll write oblique incomplete. Oblique. Now coming, sir. Plus there will be a fracture on neck. There will be a fracture of vertebra, C2 vertebra. Fracture of C2 vertebra is hangman's. It's also called as what, sir? Hangman's fracture. Now coming to the skin under the neck. So under the neck, the skin will become pale and white, because no blood supply going down. So there will be a under neck skin which will be pale and white, plain and white. First will be congestion, all the face will turn red because of the congestion. Then after that it will become blue, cyanosed, and below the knot you will see everything would be white, pale and white, pale and white, my dear friends. Now we coming to the internal finding in case of hanging. In the internal finding, there will be a hyoid bone fracture. Yes, we have discussed right here, sir. Hyoid bone fracture. Plus there will be a carotid artery injury. So in the carotid artery injury, you will see there will be a transverse intimal tears in the antemortem. This is only seen in the antemortem. If the person was alive, then you are going to see that there is a sign of struggle, and because of sign of struggle, there is a lot of pressure. Will lead to transverse intimal tears. I'll write it properly. Transverse, yes sir. Here, there will be transverse intimal tears, and these are seen in antemortem hanging. Now coming to the next part. Sir, there will be vertebral injuries. Vertebral injury, you are going to see the Simon bleed. Where the Simon bleed is happening, it is present in the anterior surface of the vertebra. If I draw the vertebra like this, you will see the bleeding happening in this area. This is Simon's bleed. Vertebral injury, you will see the Simon bleed, my dear friends. Now, the next topic what we are going to discuss is what's your strangulation. In strangulation, the only structure compressed is your neck. In strangulation, the only structure compressed is your neck, and it is most commonly homicidal. That means someone will kill you. Accidental, less chances, and strangulation judicial is also there. And judicially, we follow this in the Spain. In Spain, what they do, sir, they use the metallic collar and they just tighten the metallic collar, and the person will die because of the strangulation. See, sir, ligature mark in the strangulation. We just see the ligature mark in strangulation. Ligature mark in the strangulation, you will see someone is compressing your neck from the back. So there will be complete, yes sir, transverse, complete, and mostly below the above the thyroid can also be seen. If a person is tying some object on your neck and continuously dragging you, then it can be seen above also, but mostly it will be seen below the thyroid. But in the hanging, it is mostly seen above the thyroid, my dear friends. Now we talk about the types of strangulation. Sir, if we talk about type of strangulation, the number one type of strangulation is manual strangulation. Someone is doing with the help of hand, which is also called as throttling. Someone is manually strangulating you, it is also called as throttling, and it is always and always homicidal. Now there can be a six-penny bruise, butterfly bruise can be seen. Six-penny, how to see six-penny, sir? These are our fingertips. If we are strangulating someone with our fingertips like this, hands like this, So you'll see because of the compression, you are going to see the bruises like a penny, penny, penny. That is why this is called a six-penny bruise. And sir, if we are using this hand like this, index finger and the thumb part we are using and strangulating someone like that. So you will see there will be a butterfly bruise you are most commonly seeing. So if using hand and tip of hand you are using like this, so there will be a six-penny bruise, and if there is a index finger and the thumb you are using, there will be what's a butterfly bruising. There will be what's a butterfly bruising. Now coming to the second part, second is ligature strangulation. Now ligature. So this can be homicidal or can be accidental. And accidental, if you talk about the ligature, it is seen in the sexual pleasure. Sexual pleasure. Ligature. It can be homicidal. Person will try to kill you. You are sitting somewhere and X person came from behind and started doing like this. So in the strangulation, ligature, you will see ligature is transverse and below the level of thyroid. We have discussed it already. It is transverse and below the level of thyroid. Also, it can be seen in the sexual pleasure. While two partners are having a sexual intercourse, other partners is demanding that please tie a knot and strangulate me. While doing the strangulation, you will see the person will die eventually. Okay, sir. So these things you should not practice without having good guidance. Okay, sure. Now, my dear friends, we are having next thing called as what's a mugging. If you are taking your elbow, and you are strangulating someone like this, so this is called as mugging. This is called as mugging. Using of elbow is called as mugging. Then coming to the garroting or Spanish windlass. Spanish windlass, the metallic collar is used, and judicial in Spain and Turkey. So what is happening right here? You will see there is a metallic collar they are using. This is metallic collar. This is metallic collar, and this is the lever, or you can say the handle they are having. This is handle. So they are just moving the handle like this. Moving the handle in clockwise direction or anti-clockwise direction is tightening this collar. Moment tightening of collar is there, the person will die. Person will die. Another fifth one is Bansdola. What is Bansdola? You can see the two sticks they are taking like this. They are taking the two sticks, and between these two sticks from one end, it is what's here tied up. From one end it is tied up like this, and between this there will be neck. From the other two end you will try to keep those end near. You will try to bring those other ends near. You can see right here, sir, from the one end it is tied with the knot, from the other end you are trying, and you are putting the neck in between. This is neck in between, and moment you are putting the neck in between, what you see, other ends you try to bring them close. Moment you are trying to bring them close, there is a strangulation of the neck. Strangulation of the neck. And Bansdola, word Bans, you know, it is a stick. Bamboo stick is also called as Bans in Hindi. So postmortem finding in the strangulation, before that you should know that there is an artifact, and that artifact is called as Prinslow's Gordon artifact. What is this artifact? That means some hemorrhages can resemble strangulation. Some other hemorrhage can be also be there which can resemble the strangulation. So you should not confuse between them. To avoid this artifact, what we can do, we can go with bloodless dissection. We can go with bloodless dissection. We can go with bloodless dissection. How to do bloodless dissection, my dear friends? First of all, type of incision we are having. If I write here, sir, type of incision. It is modified by coming from this mastoid area, suprasternal notch, and then going to the pubic symphysis. Plus the organs which are dissected, there is a manner how to attain the bloodless dissection. How? So how to remember? First is cranial cavity. After cranial cavity, thorax. After thorax, abdomen. and in the last there will be a neck. In the last there will be a neck. So avoid this Prinslow's, Gordon artifact. You will see there will be a bloodless dissection which can avoid this. Now what you are going to see first is ligature mark. Ligature mark, you will see the bruising right here, sir. Postmortem finding is the strangulation. Strangulation, if some material you are using to strangulation, ligature mark is there. Ligature mark is complete. If I just remove this, ligature mark will be what, sir, here? It is complete, transverse, complete and transverse. The ligature mark will be complete and transverse, my dear friends. Plus, Tardieu spots are seen. What are the Tardieu spots? We have seen already. Tardieu spots are the pinpoint hemorrhage, where it is happening in the conjunctiva. Then in the strangulation, you can see, sir, hyoid bone fracture. Most common level is C2 level, more than C3. Then on dissection, you will see hematoma and hemorrhages seen in the neck tissue. Because of the compression of the neck, internal bleeding will be there. So there will be hematoma and different type of hemorrhages you are going to see right there, sir. Now, sir, there will be a next thing we are going to discuss, that is called as what, sir? Suffocation. The next topic is suffocation. The purest form of asphyxia is suffocation. And suffocation can be achieved by any method, mechanical method or gaseous. Gases can also suffocate you. Low oxygen can also suffocate you. In a room you are, but it is never by drowning. Never by drowning. You cannot be suffocated in the drowning. For drowning, word suffocation is not there. Just this thing you need to remember. Now, type of suffocation we are having. The type of suffocation we are having, sir, smothering. What is happening in the smothering? The mouth and the nose, the oropharynx and the nasopharynx is blocked by hand or pillow. If done with the hand, my dear friends, there will be abrasion and contusion seen. An abrasion and contusion seen in the perioral space. In the perioral space, you are going to see the abrasion, contusions, nail mark, etc. You can see like this, my difference. And this smothering is always homicidal. Some other person will come and try to kill you like this. You cannot just hold your breath and you can die. This is not possible. Mostly this is not possible. Okay. So smothering, mouth and nose is blocked with the help of hand and pillow. If done with hand, abrasion and contusion is seen, and there will be what's it? Always homicidal. Now you can see this beautiful female, what she is doing. She is taking the pillow, and the moment it is done with the help of pillow, you will not see the laceration, bruises, contusions, etc. So she is using the pillow to close the nasopharynx and the oropharynx, and this is called a smothering. Now, sir, another one. Next, sir, we are having the gagging. What is happening? The airways are jammed by putting the piece of cloth. So what this can be? Like you have abducted someone. And you don't want that person to shout or speak. You can put a piece of cloth. You are putting a piece of cloth, and that piece of cloth in a mouth is obstructing your oropharynx. Airways it is obstructing, and you will die. The person will die. This is one thing. Another thing, gagging is again done in the sexual intercourse. Some people love to put gag inside the mouth. Moment they are putting the gag inside the mouth, again the airways are blocked and the person will die. So piece of cloth, mostly it is used. Other foreign bodies can also be used to just close the oropharynx, which will constrict the airways, and because of that person will die. Now the third thing is choking. Choking, what is happening in the choking? The obstruction of airway by a foreign body or a food, my dear friends. In the choking, what will happen? The patient presentation, there will be cyanosis and there will be coughing and cyanose person. try to cough. Now the cause of death in case of choking will be what, sir? Your cardiac arrest. Laryngeal spasm can also be the cause of death in the choking. Plus asphyxia. Because of laryngeal spasm, there will be asphyxia, and management is what, sir? Hemorrhage maneuver. How to do Hemorrhage maneuver? You will just put your hand from the back on the abdomen of the person who is suffering from choking, and you will just apply the pressure. Moment you apply the pressure on the stomach, what will happen? The pressure is released and the content pressure is created from the abdomen, which is coming out. Moment the pressure is coming out, all the foreign bodies which are obstructed on the way will also be coming out from the mouth, my dear friends. So this is what the Hemorrhage maneuver is. Now we coming to another application of choking. It is cafe coronary syndrome. So cafe coronary syndrome, first of all, history can be related to obese, can be related to drunk person. These words in the exam you need to find: obese, drunk person. Obese person eating, drunk person eating, suddenly what happens, sir? Food bolus in the pharynx or larynx. Food bolus went into pharynx or larynx, and this is mechanical asphyxia happening right now. Some foreign body, food bolus, which is obstructing your airway. So mechanical asphyxia will lead to vagal inhibition, and the person will die because of the cardiac arrest. Suddenly there will be an inhibition of the vagal, and there will be vagal inhibition, then it will lead to cardiac arrest. Cause of death is asphyxia due to food and bolus in the airway. Asphyxia, the food bolus in the airway. Asphyxia due to, the whole word is like this. We'll see right here, sir. Asphyxia due to food bolus in airway. Food bolus in the airway. Asphyxia due to food bolus in the airway, my dear friends. Now, how the case presentation will be? You can write this, sir. Obese person plus alcoholic while eating suddenly becomes cyanosed and died. So here the cause of death would be what, sir? Your asphyxia in the food bolus in the airway, and there will be vagal inhibition. After vagal inhibition, there is a cardiac arrest. Cardiac arrest. This is not MI. This is not MI, my dear friends. You will not see the MI. This is because of the vagal inhibition. The things are happening right now, sir. Now we'll talk about fourth thing, that is traumatic asphyxia. Traumatic asphyxia, also known as Perthes syndrome. Perthes syndrome, asphyxia due to mechanical fixation of the chest, and cause of compression can be stampede. If stampede is there, there might be a chances that you are falling down and person are running onto your body. Because of running onto your body, there is a weight on the chest. Because of the weight of chest, the lungs will not expand, no breathing, the person will die. This is traumatic asphyxia. Another thing is in road traffic accident. Road traffic accident, sir, one condition is there, plial chest. Sir, in plial chest, what is happening? Two or more than two ribs are getting fractured. Two or more than two ribs are getting fractured, my dear friends. In that scenario also, there will be traumatic asphyxia at more than two sites. Then sexual pleasure, my dear friends. Two people are having sexual intercourse. One, the boy, if I just give you example, the boy was very thin, lying down. Female is climbing that boy, and female is putting both the hands on the chest of the boy while having the sexual intercourse. She is continuously applying the pressure. Like the boy is 50 kg, female is 150 kg. Female is continuously applying pressure on the chest while having the pleasure. And there will be no expanding of the lungs. If the no expanding of lungs will be there, the person will die because of the mechanical fixation of the chest. So these are the conditions which are seen in the traumatic asphyxia, my dear friends. So one word is there, masseche-ecchymotic. Masseche-ecchymotic, what is this? Demarcation line between the compressed and the non-compressed areas. If we see right here, sir, this is the body. If this is the body, and sir, I am applying pressure on the chest of this area of the body, you will see the blood in this area will go into this area, adjacent organs. So you will be see the area which is getting compressed. The area which is getting compressed would be pale. The area which is getting compressed would be pale. And the adjacent area will be red. So there will be demarcation line. So this is called as massive-ecchymotic. Now positional asphyxia. Asphyxia due to position of the victim. Example, this is jackknife position. You will see what will happen. Because of this position, now your internal organs will have their weight on the lungs, because of which lungs fails to contract and relax and the person will die. Another position is also there, sir. Another position is also there. We can write here, sir. This is inverted crucifixion. Inverted crucifixion. What is inverted crucifixion? I'll draw right here, sir. In this, head is down. Head is down like this. Like this. Person is tied like this. Now entire internal organs are having pressure on the lungs and the person will die. This is inverted crucifixion. Done, sir. Now coming to the burking. The sixth application we are having right here, sir. That is what's a burking. Burking, you will see this is a mixture of smothering and traumatic asphyxia. So what is smothering? Smothering, there is a closure of oropharynx and nasopharynx. Smothering, what is happening? The closure of oropharynx plus nasopharynx. And so smothering, after smothering, there will be a traumatic asphyxia. Traumatic asphyxia, that is a mechanical fixation. Fixation of the chest. So one person is closing the nasopharynx or oropharynx, other person is climbing onto the chest. This is a combo of both smothering and traumatic asphyxia. This is called as burking. And burking is always homicidal. It can't be suicidal, it's always homicidal. It needs at least two people. It needs at least two people or one person who is putting one knee on the chest, compressing the chest, and with the other hand it is closing your oropharynx and the nasopharynx, my dear friends. Now coming to the other thing called as what, sir? Next thing we are having, sir, overlaying. Happen when an obese mother sharing a small with an infant. Infant, 0 to 28 days child is called as infant, and it is always and always accidental. Obese mother, the child is sleeping on the same bed. While sleeping, mother rolled onto the child and the child died. Infant died because of this is called as overlay. One more thing is there, sir. Eighth one, that is wedging. What is happening? The wedging, the baby was sleeping. Sleeping baby fall down. Sleeping baby fall down. Fall down between bed and wall. Can be between mattress. Can be between two mattress. The cause of death will be suffocation and compression. Suffocation and compression will be cause of death. The baby is sleeping on the bed. There is a gap between bed. Baby fall onto that gap and there will be compression. So this is again a accidental. This is again what's an accidental. Now we are coming to the next topic. And my dear friends, next topic is all about the drowning. So what is happening in the drowning? The body inside any liquid, and complete submersion of the body is not required. Only if the head is inside the water and the person is dying, that is also called as drowning. Not all of the body is required in the liquid. Only if head is there, then also we will consider this as drowning. And drowning is body inside any liquid. It's not always water. It can be liquor also. Any liquid can be there inside body, can go and die. This is called as drowning. And drowning is most commonly accidental. Why drowning is most commonly accidental? Because the fatal period is more, 5 to 8 minutes. The struggle is more, the pain is more. That is why the drowning is mostly accidental as compared to the suicidal. Less people choose water to die. More people use hanging to die, because in hanging the fetal period is lesser as compared to the drowning, my dear friends. Now we talk about the type of drowning. So different type of drowning we are having. 4 type drowning we are having, sir. Freshwater, dry, hydrocution and near drowning. First, I'll just give you overview here and then we'll be discussing everything in the detail, my dear friends. Now we talk about the drowning. Drowning can be in the fresh water and the sea water. Fresh water has different cause of death. Sea water has a different cause of death. If we talk about the fresh water, what will happen? The water will be going inside the alveoli. From alveoli, it will go into the pulmonary capillaries. Pulmonary capillaries will have a lot of blood. Lot of blood can lead towards your hypervolemia. Hypervolemia can lead to hemodilution. Hemodilution will lead to breakdown of RBCs, and RBCs will lead to increase in potassium, and potassium will lead to the ventricular fibrillation. Arrhythmias will be the main cause of death right here. Other thing can happen, there is a congestion, and because of congestion, cardiac arrest can also happen. Sea water, what is happening? There is a sodium concentration which is increasing. Because of increase in sodium concentration, the cause of death will be bradycardia in the sea water. Now coming to the dry drowning. Now what is happening in the dry drowning, friends? The person is diving inside the water. Moment the person dived inside the water, what happened? There was a laryngospasm. Laryngospasm happened. That means no water, no air is going inside and the person will die. Hydrocution. What is hydrocution? See, there is a cold water. There is a cold water in which you are jumping suddenly. When you are jumping inside the cold water is touching the epigastrium. And on the epigastrium region, here you will see there is a diaphragm, and diaphragm is supplied by the vagus nerve. Now there is a vagal inhibition right here. Because of the vagal inhibition, your diaphragm fails to relax. If diaphragm fails to relax, there will not be a lung expansion and the person will die. Fourth is your near drowning. In near drowning, you will see what is happening. You saved the person from the water. You jumped inside. There was a beautiful girl who was trying to kill herself. But eventually, you are like a Superman. You went inside. You pulled that girl outside. You have given all the CPR, etc. to the female, and female was absolutely fine. But after 24 hours or 1 to 2 days, the female died. The cause of death can be 2. One is the water which went inside has lot of infection and the female died because of septicemia. Second cause of death will be the electrolyte imbalance which happened in the body. So these are the 4 type of drowning. What we are doing now, we will be discussing one by one in detail, my dear. So first we are having what's a wet drowning. Wet drowning, number 1 topic is freshwater drowning. Now water is entering in the pulmonary capillaries. Where the water is entering, sir? Pulmonary capillaries it is happening. How it is happening, sir? Let me just show you with the help of diagram. Sir, this one is your alveoli. And just near to alveoli, you are having the pulmonary cavities like this. And this is alveoli. This is pulmonary. This is pulmonary capillary. Now what is happening, sir? From here, alveoli, the H2O, water will come here. This will lead towards your hypovolemia. This will lead towards your hypervolemia. Hypervolemia. This will lead to hypervolemia. Because of this hypervolemia, what can happen? One thing is cardiac arrest. Cardiac arrest can happen. Other thing what can happen is because of hemodilution. There will be hemolysis. Because of hemolysis, potassium will increase. Potassium will increase. There will be what's a ventricular fibrillation. Ventricular fibrillation. So these are the 2 things you need to remember here. So what is happening in the freshwater drowning? Water entering in the pulmonary capillaries lead to the hemodilution. Lot of then it will lead to hemolysis, and there will be a ventricular fibrillation because potassium is increasing. Cardiac arrest is happening moment there is a hypervolemia, because lot of water, from here you can see the lot of water which is entering the pulmonary capillaries, you will see there is a hypervolemia also. And because of this hypervolemia, you will see there will be lot of congestion. Lot of congestion will lead towards a cardiac arrest. Lot of congestion will lead towards your cardiac arrest right here, sir. Now we are moving to the next thing is seawater drowning. Now seawater drowning, the water entering into the pulmonary capillaries. And what is happening? The sodium is increasing along with the magnesium. And this sodium, guys, remember there will be a hypernatremia which will lead to the bradycardia. Also, cardiac arrest is happening, same mechanism. What is happening? There is a hypervolemia. Hypervolemia will lead to congestion, and because of congestion, there is a cardiac arrest. So, most common cause of death in the seawater drowning is bradycardia, which will lead to cardiac arrest, and in the freshwater drowning, the cause of death will be what's your ventricular fibrillation. Can also happen cardiac arrest, but most common is ventricular fibrillation. Here in the seawater, the most common is what's your bradycardia. Now, sir, as we discussed, the second thing is what's your dry drowning. Dry drowning, sir, no water is entering now in the lungs. There is no water which is entering inside the lung. Now the death is happening because of the laryngospasm. Moment the person entered inside the water, or before entering the water, in the air itself there is a laryngospasm, or after entering, just after entering there is a laryngospasm. So larynx will be closed, there is no air, no water going inside, and the person will die. This is called as what's your dry drowning. Now coming to the hydrocution or immersion syndrome. Hydrocution or immersion syndrome, what is happening, sir? The cold water touches the nose, ear and the epigastrium. Now the cold water is extreme cold water. Sir, extreme cold water is touching your nose, ear, epigastrium, and there is a vagal nerve going on. Moment there is a vagal inhibition, your cardiac arrest will happen, my dear friends. Cardiac arrest will happen. Also, vagus nerve is supplying your diaphragm in the epigastric region. Diaphragm also fails to relax. If diaphragm fails to relax, the lungs will not expand. If lungs will not expand, the person will not be breathing and the person will die. Now, sir, next thing is near drowning, or it is also called as delayed drowning. Near drowning or delayed drowning. Now, death is happening after 1 to 2 days. The victim survived. Someone saved the victim. But after 1 to 2 days, the person will die because of the pulmonary infection. Electrolyte imbalance, also hypoxic ischemic encephalopathy. My dear friends. Now we'll see something called as ante-mortem changes in the drowning, my dear. Now we'll talk about the ante-mortem changes in the drowning. So first of all, ante-mortem drowning means what? Ante-mortem drowning means the death is happening inside the water. That means when the person died inside the water, the person was alive. Before going into the water, the person was alive. This is a simple layman word you can understand. First thing, what can happen if a person was alive before going to the water, before dying inside the water? There will be a cadaveric spasm. Spasm means there is a contraction of the muscles. And why this cadaveric spasm is happening, my dear friends? Because the mechanism of action is decrease in ATP. Because a lot of use of ATPs will constrict the muscle like this, and hand will have something inside. If hand is clenched like this and hand is having grass particle, mud particle inside the fist, that means person was alive and person had struggled a lot inside water to survive, to breathe. While struggling, how painful it was, he just took the sand, etc., whatever it was, he clenched his fist like this. This is cadaveric spasm, only and only seen in the ante-mortem drowning, where the person was alive before dying or before going inside the water, or you can say the death happened inside the water. Now, sir, most specific sign of the ante-mortem drowning would be your cadaveric spasm. Plus, when a live person goes inside water due to struggle, there is a continuous muscle spasm lead to cadaveric spasm. Continuous muscle spasm is there, decrease in ATP is there, which is leading to the cadaveric spasm. Cadaveric spasm. Now, another thing is the water and the mud you will see in the lung and the GIT. In the both you will see the water, along with the water you will see the mud particle which are going inside. Now, sir, when the water is going inside, you will see the water will be irritating. Water will be irritating the airways. The water irritates the mucosa. Result is increased mucosa plus surfactant which comes out as froth. The frothing is happening because if I draw like this in the trachea, there is a irritation by the water. A water is also having the mud particles. These are continuously irritating. Because of the continuous irritation, the froth will be coming outside. Now, what is the nature of this froth? My dear friends, the nature of froth is leathery mucoid discharge. And what this mucoid leathery discharge is there? This is mucin plus surfactant which are overproduced due to the irritation of the airways. Irritation of the airways. And this froth in the nostril will only come once the person was respirating or person was alive, or you can say ante-mortem drowning. Now, sir, next term is emphysema aqueosum. Now, emphysema aqueosum is seen when conscious person dies in the lungs are spongy and dilated, plus air bubbles and water will mix inside the air bubble and water will. This is emphysema aqueosum. Now, other finding you will see, which is oedema aqueosum. Oedema aqueosum, it is seen when unconscious person drowned in water and then died. Edema aqueosum. There is an edema in the lung. There is an edema in the lung. Okay. Next, fault of hemorrhage. Sir, the rupture of alveoli capillaries due to the forced respiration means person struggled a lot to respire inside the water. Now, if I draw lungs right here, sir, like this, the fault of hemorrhage is a pinpoint hemorrhage happening in the lower lobes, like in the lower lobes like this. This is fault of hemorrhage happening in the lower lobes, my dear friends. And now common changes in the ante-mortem and the post-mortem drowning. Sir, what are the common changes you are going to see in the both ante-mortem and the post-mortem? Number one is washer woman hand, and this is seen in normal person also. Normal person, if you will put your hand inside the water, you will see there is a wrinkling of the hand, and this can be seen in both ante-mortem and the post-mortem. Now, it helps in the time since death, TSD, time since death, it will help you. So, what will happen in the first 3 hours, there will be wrinkling of the skin. Then in the another 12 hours, you will see the bleaching of the skin. Within 3 hours, you will see wrinkling. Then after 12 hours, bleaching will be there. Then 1 day, soothing will be there, and peeling of skin will be seen after 2 to 3 days. So, body will get decomposed in water. You have heard a thing called as Casper dictum. Sir, first of all, there is a air. Rate of decomposition is very high, then water. And sir, then land. In air, it is 1 week. Water, it is 2 weeks. Land, it is 8 weeks. These are the rate of decomposition. So, water, you can see what is happening: wrinkling, bleaching, soothing, then peeling of skin will happen. Body decomposition will happen. Then sir, we talk about the flotation of the body. Flotation of the body is because, why the flotation of body is happening? It is because of the decomposition of the body. The gas is produced, and which is the predominant gas which is produced would be the hydrogen sulfide. Sir, in the hot environment, in the hot climate, what will happen? The biological reactions happens fast. If the biological reactions will happen fast, what will happen, sir? There will be the flotation, or you can say there will be the production of gases faster. If I compare this with the summer season and the winter season, in the summer, because of already there is a heat in the environment, the body will be decomposed fast, the production will be fast, the gases will be produced fast. That is why flotation is fast. In the winter, where the reactions, biological reactions are slow because of the climate, the gas production is also bit delayed. That is why flotation is also delayed. So we can see right here, sir, in the summer it is 24 hours, in winter it is 1 to 2 days. Summer 24 hours and in winter it is 1 to 2 days, 1 to 2 days. Now another thing is cutis and cernia. Cutis and cernia, due to the contraction or of erector pylori muscle, goosebumps are seen. And goosebumps can be seen in both ante and post-mortem. See why this erection is there? Because of the rigor mortis. What is rigor mortis? Rigor mortis is what, sir? Your rigidity, and rigidity is also happening because of decrease in ATP. Moment the muscles are becoming constricted and narrow, these pylori muscles will also become narrow. Because of the narrowing, there will be the erection of the hairs, and which are called as goosebumps. Which are called as what, sir? Goosebumps. Now, sir, next thing is important test in the drowning. If we talk about the important test in the drowning, we are having diatom test. So diatom is what? What is diatom? Diatom is unicellular. Sir, diatom is what, sir? Diatom is a unicellular algae covered by the silica. And silica is resistant to the heat. That is why after having extreme worse climatic condition, it will be found inside the water. So diatom test, see, there are two type of diatoms we are having: oligohalophilic and polyhalophilic. Oligo is seen in the fresh water and poly will be seen in the sea water. The oligohalophilic is seen in the fresh water and polyhalophilic will be seen in the sea water, my dear friends. Other thing we are having in antemortem drowning, diatom size is less than 60 micron and can be seen in the long bones because of the circulation was present. So I'll just explain you the mechanism by what two ways the diatoms can reach the long bones. Sir, first thing is alveoli. If the diatom size is less than 40 micron, the diatom was present inside the water. Now this will come inside the pulmonary capillaries. From pulmonary capillaries, it can come in the heart. From heart, it can go into systemic circulation. From systemic circulation, it can settle in the long bone. Long bone. And this is only possible if the person was breathing before the death. Breathing before the death. Other method, how it can go, sir? It can go inside the GIT. From GIT, it get absorbed in the blood. From there, it can settle in the long bone. From there, it can settle in the long bones, my dear friends. So, best bone is femur and most common is sternum, where you can find the diatoms. Diatoms can only be present if it is antemortem drowning. It is what's an antemortem drowning. Now, how the test is done? Bone sample plus nitric acid will mix and diatoms we'll see under the microscope. We take a bone sample from sternum. We have taken the bone sample. We mix nitric oxide and then we'll see under the microscope. We'll easily be able to see diatoms. If diatoms are present, that means antemortem drowning was there. Next test is what, sir? Your Gettler test. Gettler test is comparison of chloride concentration in right side of the heart and the left side of the heart. Ideally, in the normal person, you will see, sir, right side and left side chloride concentration is absolutely normal. They both are equal. In the left side and the right side, the chloride concentration is equal, my dear friends. But if we see right here, sir, in the freshwater drowning, what will happen? Right side is having more than the left side. The chloride concentration in the right side is more than the left side, my dear friends. And in the seawater drowning, where the cause of death was bradycardia, here left side chloride is more than the right side. Left side chloride is more than the right side, my dear friends. Thank you so much.